going to learn an interesting session on in vitro fertilization. So are you all ready to listen? Okay. What is IVF? IVF is nothing but in vitro fertilization. In vitro fertilization means what? Usually the fertilization process takes place inside our body, right? We call it as in vivo fertilization. If the fertilization happens inside our body, it is called as in vivo fertilization. When the reproductive process takes place artificially outside the body, we call it as in vitro fertilization. So that is the term for IVF. So this IVF treatment is one of the treatment which comes under ART. ART is nothing but Assisted Reproductive Technology. This Assisted Reproductive Technology helps in infertility treatment. What do you mean by infertility? Any idea? So, when a couple who gets married after 1 year period of unprotected sexual intercourse, if they are not able to conceive, we call it as infertility. We have male infertility causes and female infertility causes. In such situation, they prefer this assisted reproductive technology, which is commonly called as ART. Under ART, we have so many types. So I just want to tell you all a common thing. Nowadays, the disease pattern and the increase in the number of diseases have added on to this incidences of infertility. When you go into the society or community, if you pick up 2 girls, out of the 2 girls, 1 girl will be affected with PCOS, which is a common condition in young females nowadays. But if such kind of situation add on, and that is deliberately ended up in IVF treatment nowadays. So under ART therapy, we have so much of treatment module. Let's see one by one. First is ovulation stimulation. So in case of simple PCOS or PCOD condition, what the doctor will do, they will give some sort of drug which will improve the ovulation process so that the patient or the people, the women may ovulate a good quality of egg. So it is a simple medical management treatment. So to start off with artificial reproductive technology, they will go with this ovulation stimulation treatment as a first step. If in case, if it is failed, they will switch over to the another step which is called as IUI. IUI is nothing but intrauterine sperm injection. What they will do, they will collect the sperm manually and they will inject into the uterine cavity of the women. So artificially they will externally they will collect the sperm and they will inject manually into the mother's, the uterus. So it is called as IUI. Next step is IVF, in vitro fertilization, where the sperm and the ovum are collected and they will get fertilized outside the body and then they will transfer the embryo into the mother's uterus. It is called as IVF. We have a couple of new things which is coming under, which is called as ZIFT and ZIFT. ZIFT is nothing but gamete intrafallopian transfer. What they will do, in the gamete stage, they will collect and they will transfer it into the fallopian tube. Same way, ZIFT, Zygote Intrafallopian transfer. So in the zygote stage, they will collect it and inject it into the fallopian tube. Thereby the ovulation and the fertilization process takes place. And the last one is the advanced treatment which is existing in the nowadays, which is called as ICSI. ICSI is nothing but Intracytoplasmic sperm injection. The sperm will be injected directly into the cytoplasm in order to make the fertilization process so easier. So these are all the different type of ART therapy. In ART therapy, we are going to learn about IVF in today's session. Okay? When the couple will go into the assisted reproductive technology, so what are the indications for IVF? We will categorize into 2 causes. One is female causes, another one is male causes. What will be the female causes? You all imagine our uterus. Say for example, in this picture, some uterine picture is there, no? You can just imagine. Any problem in the uterine body, either it can be endometriosis or endometrial fibroid, polyps or any endometrial disorders or the disorders related to uterus, they may go into IVF therapy. Second is the tubal. Next part is the tube. So any disorder in tubes. Say for example, tubal adhesions, the patency of the tube will not be good. Some sort of polyps, minor polyps will be existing in the tubes. in some situations the cilia function inside the tube will not be proper, the propelling of sperm will not be there due to improper or impatent tubes. So all the tubal conditions will interrupt the pregnancy process. Third is your ovulation dysfunction. So ovary may not be able to produce good quality of egg due to some other disease condition related to ovaries. So these will be the three causes which will be involved in female. One related to uterine part, second related to this tubal part, and third related to this ovarian part. Any disorders from the uterus, in the tube or in the ovaries. So in that situation, patient may switch over to IVF therapy. So what will be the male causes? We will have a mnemonic here. The mnemonic is sperm. So due to this sperm mnemonic only, patient may end up in going into IVF therapy. So S stands for the sperm count. The sperm count, usually what is the normal sperm count? Yes. So if the male, a good male has got more than 16 million per ml of sperm is the normal and recommended to get conceived. When the sperm count is less than 5, we call it as oligospermia. In such situation, the good quality of sperm will not be produced. So they may switch over to IVF therapy. What is P? Progression. Progression is nothing but the motility of the sperm. In some cases, what will happen? The count will be good. It will be more than 16 million or sometimes more than 20 to 30 million also. But the progression, the motility will not be good. So the chances of pregnancy will be impaired there. So P stands for progression. E is the ejaculation. So due to any ejaculation disorders, so they may not able to get conceived. R is the reproductive system dysfunction. When there is any abnormality in the male reproductive tract, they may not be able to produce good quality of sperm. And the last M is the morphology. Morphology is nothing but the anatomy of the sperm. It has got the head and tail portion, right? So when there is any morphological deficit, so there will not be any good quality of sperm will be there. So that may end up in patient getting into IVF therapy. So these are all the two causes existing in indication for IVF. One is female causes, another one is male causes. Let's move on to the steps involved in IVF therapy, which is a very important crux of today's presentation. It involves 7 steps. The picture clearly defines each and every single step which is involved in IVF process. One is ovarian stimulation. What they will do? They will stimulate the ovaries with the help of hormonal injection. Usually HCG injection hormone will be given for the mothers after the menstrual cycle. The first process is ovarian stimulation. So usually the HCG hormone will be given subcutaneously for a certain period of time, and every day they will check with the help of scan how the growth of the ovum exists. So one particular point of time the egg gets mature, they will go into next step which is called as egg retrieval. What do you mean by egg retrieval? So they will inject pipette kind of thing in the theater into the mother's uterus, and they will collect the good quality of egg. So that is the second step, which is called as egg retrieval, or commonly we say it as egg collection. So what is the third step? Parallelly they will collect the sperm from the partner. So third step is the sperm collection. What is the fourth step? Laboratory fertilization. The collected sperm and the egg will get fertilized externally in the laboratory, so which is called as fertilization process. So that is the fourth step. With the help of petri dish, they will put the sperm and the ovum, and manually they will make it to fertilize in the laboratory environment. What is the fifth step? The embryo culture. So embryo culture, they will make that into the culture media so that the blastocyte formation. So till the embryo stage, they will make the embryos to get developed. So that is called as embryo culture. What is the sixth step? The collected embryo is then transferred into the mother's uterus with the help of aseptic procedures. So that is the sixth step. And the last step is after 10 to 15 days or 14 days from the ET, they will check the mother's pregnancy test for the positive result. So these are all the 7 steps involved in IVF process. One is ovarian stimulation. With the help of that, they will stimulate the ovary so that mature egg will get collected. Second step is the egg retrieving, also called as egg collection. Third step is the sperm collection. Fourth is the fertilization process. That is manually they will make the egg and the sperm to get fertilized. fifth is the embryo culture, and sixth is the embryo transfer, commonly called as ET, and the last is the pregnancy test detection. So these are all the steps involved in IVF process. Is it clear to you all? Okay. Next is the advantages of IVF. So what will be the advantages? It's very easy. So it helps the infertile couple to get conceived, and the success rate will be more when compared to other methods, and embryos can be frozen for future use. Nowadays what the couple are telling, they are preserving the embryos for later uses. So after 3 years or 4 years, if they want to get any twin pregnancy or triplets or something, they can at any time they can go and get their IVF treatment done, and they can have their embryos get transferred. It can also help to prevent transmission of certain genetic diseases and increases the chance of pregnancy in selected patients. These are all some of the advantages involved in IVF treatment. So as like other treatment, this treatment also has got some sort of risk and complications. What are all those risks? One is ovarian hyperstimulation syndrome. So you all know, everything it get overstimulated, what will happen? Hyperstimulation will be there. Sometimes more number of eggs will be produced, which make the mother to get some sort of disorders, or it makes the ovary to become heavy, and chances of torsion will be there. So hyperstimulation is one of the complication. Multiple pregnancy, again a common complication. Ectopic pregnancy is also an expected complication. Sometimes chances for miscarriage, bleeding may happen, and emotional and financial stress also will be happening in some sort of women. So these are all some of the risk and complication involved in IVF treatment. So here comes the role of the nurse. Nurses play a very important role in every of the treatment procedure, right? So what is the role over here? We have to be with the couple. We have to treat them as not like a patient. They are like persons, no? So we should not treat them or call them like a patient. We have to make them as a normal human being and handle them. Emotional and psychological support plays a major role in IVF treatment. Though they get any sort of drugs and other treatment, the simple emotional and psychological support will add more value in such kind of customers. So as a nurse, we have to provide good psychological and emotional support. Administer fertility medication with more care and cautious. Since it's all involved hormonal injection, right? Every single number is also matters. So we have to calculate the dose correctly and administer it accordingly. So we have to be much more clear and confident with the fertility medications. Monitor the patients regularly. Assist the doctor during egg retrieval process and embryo transfer process. And wherever possible, we have to maintain sterile aseptic technique. And provide discharge education and follow-up care, which is also very important. We have to tell the people they should take adequate rest, plenty of oral fluids, take more sort of fruits, vegetables, nuts, greens, and they should have a healthy lifestyle. So they should not think or worry. They should actively involve in meditation and other mind guiding exercise and all those things. So all these things you have to educate. These all will not be told by doctor. They will just prescribe the drug and go off. You as a nurse should be with the patient and teach all those important points in order to improve the success rate. So what will be the success factor? IVF treatment is done, everything is over. In what basis the success factor decides? It depends on the woman's age, the quality of eggs and sperms, so the causes of the infertility, and the quality of embryo, and healthy lifestyle and skilled fertility team. So these are some of the factors which determine the success of IVF treatment. We should always keep this in mind. So finally, what is the take-home message from this session? So IVF is one of the important and successful ART therapies, and the embryo is transferred into the uterus in this process, and fertilization takes place outside the body. Nurses play a very important role in patient education, care, and emotional support. Proper counseling services improve treatment outcome. So we have to keep all these points in mind, and we have to treat the patients, not the patient, the customers, in a respectful and dignified manner, and make their outcome to get better and better every day. So hope this session is useful to you all. Thank you.